we want to talk about our polls. Our patients wanted to hear about dental implants. So we're making short, concise, and call it Dental Implant 101. So what happens when you lose teeth? When you lose one tooth, when you lose two teeth, or you lose all your teeth, basically your body goes through a mechanism called atrophy. The jawbone begins to shrink. So this is demonstrated by a full jaw. Somebody loses all their teeth, their bone begins to completely resorb and shrink. That causes a lot of problems with eating, chewing, your face sinks. So people seek us out because of dental implants. Well, what is a dental implant? I call dental implants as the best thing that happened to dentistry. Why? Because it reconnects people to something that they've lost. When you lose a tooth, you lose the ability to eat, you lose the ability to smile, you lose the ability to function, right? It's no different than you losing a body part. You lose a finger, you have a hard time holding things, writing things, and so forth, right? You lose an eyesight, you need both of your teeth, your eyes to see. So we need all our teeth to function. So a dental implant is titanium-based implant that goes into the part of the jaw. It's put into the jaw to let it heal, and then we can put a tooth on there. So the dental implant consists of dental implant and the abutment and the crown. That's one component. It's all one component. When people call and say, do you guys do dental implants? Yes, we do all part of dental implant. We do taking out the tooth, we do placing the implant, we do the prosthetic part. That's what our uniqueness is. We do all aspects. You don't have to go somewhere else for the implant and then come back over here to do the tooth. No, I'm able to do all part of it because an implantologist is supposed to take care of all aspects, including the dental work, the tooth part. Also, patients come to us for multiple teeth missing. So we can also put in multiple implants and bridge teeth, or our signature treatment when somebody is losing all their teeth or is wearing a denture. We can put in anywhere between 4 to 5 implants. They go in your jawbone, not in your gums, and we can attach a full set of non-removable teeth to the implants, and this is done in one day. So in all essence, in combining everything, dental implants is the best thing that happened to dentistry because it's reconnecting our patients to something that they've lost. We're giving them confidence, we're giving them chewing function, we're giving them quality, we're giving them longevity, and we're preventing the face from sagging and drooping so they can talk and they can smile for pictures and so forth. So this is what a dental implant is. Your next dental implants or multiple dental implants or full jaw implants. Next time we're going to talk about veneers. Veneers are very different than implants. They're two separate treatment modalities. Dental implant, if you literally look at it, it's mostly revolves in orthopedic procedure because you're utilizing putting implants in the jawbone and then you're putting teeth on top of the implants. So a totally different function versus veneers. Veneers is more cosmetic.